Okay, endometriosis is clusters of cells from the lining of the uterus. The lining of the uterus is called the endometrium. Endometrium. Endometriosis is out. Clusters of cells from the lining that are outside of the uterus. Endometriosis. The clusters of cells can be anywhere in the body. They can be in the brain, they can be in the inner ear, they can be in the lungs. I had a patient, she had a period out of her belly button every month. And then I had another patient, she had a big patch of it in her calf that would turn all purple and swollen and painful every month when she got a period. Well, we really try to work with the patient, and it depends on their age. So if we have a younger patient, the ideal way to treat her is to, one, to preserve her fertility, because endometriosis can make it difficult for you to get pregnant when you're ready to get pregnant. And two, we want to relieve her symptoms so she can get up out of bed and go to school and go to work and have a normal life. So there's different options. We have hormonal options, some other medicines that are a little bit stronger that can kind of shrink down the endometriosis, and then talk more about hormonal options. Women who are older and who are finished having their children, a good option for them is to have a hysterectomy. Once you go through menopause and the ovaries quit functioning, because endometriosis grows from the hormones of the ovaries, then if you have a hysterectomy and get one or both ovaries out, the symptoms can go totally away and you can feel free and have a regular life. In the old days, when I was in training, my professors told me that only women who were in their mid-30s to mid-40s could get endometriosis. And that didn't make any sense to us upcoming doctors, because a lot of the symptoms of endometriosis, which is bloating, low back pain, pelvic pain, fatigue, just feeling sick, were happening with young women. Terrible cramps where they couldn't even get out of bed every 2 to 3 days a month when they have their period. So we started actually doing laparoscopy on younger women and finding out that younger women also had endometriosis. And so because of that heightened awareness of knowing that it's a systemic disease and it has more symptoms than just pain with your periods, I think we are quicker to make the diagnosis than a lot of doctors here at a Women's Healing Center. So I'm pretty proud of this case. I had a patient, and she actually is a physician, internal medicine physician, and she came to me because she was in her mid-40s. Whenever she would have her period, she had horrible, terrible pain right here, and it was so bad it would cause nausea and vomiting, and she couldn't get out of bed and leave the house for several days. And she had gone to Mayo Clinic, and Mayo, is renowned for doing the $1 million workup, and they did a whole workup on her, and they told her they could not find any cause of her problems that she was having when she had her period. And when she came to my practice and talked to me, I said, I wonder if you have endometriosis on your diaphragm, and then it's acting up when you're getting your period and it's causing your symptoms. So we actually gave her a medicine that temporarily shut off her ovaries, because the endometriosis grows from the hormones of the ovaries, and her symptoms went totally away. And then when she was ready, she just stayed on the hormone that shut off her ovaries for a while, and then when it was convenient for her, we did a hysterectomy, and she's pain-free and symptom-free.